Okay, so first I'm going to perform hand hygiene. And let that dry. Then I'm going to put some gloves on. Okay, and then I would put a band on baby's foot, but we don't have one in here. So I'm just going to start drying baby off. And we would have baby in the warmer. Just kind of warming baby up. Okay, and then I would do an APGAR at 1 minute and 5 minutes, and that is appearance, pulse, grimace, activity, and respirations. And then I'm going to go ahead and suction baby. And then if baby needed oxygen, we would provide oxygen, but he does not. Okay, I'm going to go ahead and measure baby real quick. And baby's about 20 inches long. Okay, and then I'm going to measure the head circumference, which is about 13 inches. And then I'm going to measure the chest. And the chest is 12 inches. Okay, looks good. And then I'm just going to do a general look over of baby while I'm doing that, just to make sure that there's no abnormalities. Yes, and then we're going to go ahead and administer the erythromycin ointment to the eyes. And I'm going to start at the inner corner and go outwards. And then we'll do the vitamin K shot, and we do 0.5 mLs of that. Make sure I have the right. And then I would make sure that this is the correct medication. I have my correct patient and the right dose. And it is. And then also, we don't have a thermometer in this kit, but I would take baby's temperature under the armpit. Okay. All right, and then I would just double check my dose again, and I do have 0.5 milliliters, and we would give this in the, I can't think of the muscle. We would give this in the thigh of the infant. So go ahead and alcohol it. Okay, and then you just pinch the skin. Go ahead and administer that. And then I would put that right in the sharps. Okay. Okay. And then we also, when we do the APGAR, we'll just listen to baby's pulse and make sure that we're hearing everything. Okay. Baby sounds good. Okay. And then I'm just going to stick a diaper on him, and then we'll give him back to mom. And give them a chance to bond and let her try to breastfeed. Okay, so I just wrap baby up and give him to mom and let them have a chance to bond. And then when we take baby again, we'll do the rest of the assessment. So I guess we can leave that one for a minute. Okay. So we're gonna assess baby's vitals. Again, we would take a temperature. We don't need a blood pressure unless it's facility policy or they asked for it. And we would do that on the baby's leg. And then I'm gonna go ahead and listen to heart sounds. Okay, and I'm also listening to the lung sounds. And while baby's on his back, I'm gonna listen for bowel sounds. Okay. And S1 and S2 heart sounds are present, bowel sounds are present. And we're gonna listen to the back of the lungs. Okay. And lung sounds are present and equal. All right. And I would put a hat on baby when I give him to mom. I just forgot to do that. Okay. And I'm gonna feel baby's head. I'm feeling for any abnormalities, any, encephalopatomas, which would be really soft spots. The fontanelles will be soft. We don't want them too squishy and soft. And then any sesamoidema, which would be any hard spots. And I don't see any of those, and it looks good. And then we would check. We're just gonna make sure that the pupils are equal and reactive, and they are. And then we're also assessing the face for symmetry, looking at the ears for symmetry, nose, and the whole face. We're gonna check the sucking reflex. Baby does suck on the finger. We're checking the mouth and the lips for any deformities that would make it hard to eat. We can also check the rooting reflex while we're at baby's face, and baby should turn head when the cheek is brushed, and he did, so that's good. Then we're also going to palpate the abdomen, just assessing for tenderness or distension. I'm just going to go down as we're looking. We're going to feel for pulses and capillary refills, and we'll do the same down here. Okay, good. And then when I'm doing that, I can check for the palmar reflex. So baby's fingers should curl around my fingers. And then I'm checking for the palmar crease in the hand. And then I'm going to check for plantar reflex. So you would just stick your finger under their toes, and their toes should wrap around your fingers. And then to check Babinski, I'm just going to brush baby's foot, and they should move and curl their toes. And then we can check baby's Moro reflex, which is a startle reflex. So we would just set baby down and put their head a little bit lower than the rest of their body, and their arms should flow out. And his did, so that is good. We're going to assess the chest for any abnormalities and watch the breathing. Make sure there's no retractions. We would gently turn baby's neck from side to side to make sure he can move it. We can also check the other joints to make sure that there's no resistance. You just want to gently do that, making sure that there's no clicking or popping. Okay. And then, his leg doesn't want to straighten. And then I would check the cord. I am seeing 3 vessels, which is good, and it should still be wet. And then I'm going to turn baby over and just feel for any deformities on the back. I don't feel any. His head's falling off. Okay. And then I'm just going to go ahead and take a look at the genitals. This is a boy, so if he was circumcised, we'd be looking at that. Looking for any cryptothyroidism. Just checking to make sure. I mean, obviously there's going to be redness, but we don't want too much redness or swelling. If it was a girl, you would assess for a fake period, which is just a little bit of bleeding after baby's born. For a female. We can go ahead and put the diaper back on. And then we would assess baby familia, which is just kind of like baby acne. So it typically just seen on the face. It's not harmful and does not need to be treated. It usually goes away within the first few weeks after baby's born. We would assess for any port wine stain, which is just a birthmark. Also does not need treatment and is normally permanent. Sometimes it can go away, but it normally stays. And then we would assess the back side for Mongolian spots. So normally they'd appear on the back or on the bottom area on typically darker skinned babies. They can go away with age. Sometimes they don't. They don't require treatment, so they're not harmful to baby. Oh, and then I'm gonna assess the skin. I didn't notice any jaundice or cyanosis, but I would look for that. Baby skin feels soft. I don't see any abnormal bumps or like abrasions that we need to be aware of. Baby was delivered vaginally. There was no forceps or vacuum used, so we don't need to check the head for that, but if there was, we would assess that. Oh, and then I would document baby's first meconium and first, wet diaper. I can't think of the word for it. And then baby is breastfed, so we would just assess that baby's doing well that way. If mom has any questions, make sure that he's tolerating it well. You can put his hat back on. Oh, so for pulse, baby's pulse should be within 120 to 160, and then respiration should be about 30 to 60 or 40 to 60. I can't remember. Okay, and then I would wrap baby up in the blanket and return him to mom, and I'm done.